You wake up in a hospital in the United States, sometime in the 1940s, harsh white light, the smell of ether, and a man in a lab coat approaching you with a pickaxe. No, this isn't a dream. You're just about to have your brain adjusted like a crooked painting on the wall. Sounds like a horror movie, right? But this was real medicine. It was called lobotomy. The miracle cure promised for everything from schizophrenia to that aunt who talked too loud at dinner. Genius, right? It's like someone saying, your radio's making noise, just smack it with a baseball bat and see if it helps. Back then, the brain was basically a noisy old radio. And doctors? Well, they were angry repairmen with zero warranties. The term lobotomy sounds fancy, like an expensive drug, but it comes from Greek. Lobo, as in brain lobe, and tomy, meaning to cut. So, yeah, it literally meant sticking a blade into your head to disconnect a few wires. No big deal. Like prying open your laptop with a kitchen knife to see if it boots faster. The first person to come up with this brilliant idea was a Portuguese man named Antonio Egas Moniz. And get this, ironically, the man won a Nobel Prize for it. Yep, the same award given to people who cure diseases was also handed to someone who thought the best way to treat a patient was to shove a rod into their eye. And what was his big scientific argument? I tested it on 20 people and, surprise, 7 got better. That's good enough. I can just picture Moniz with an Excel spreadsheet, celebrating like he just hit his Tupperware sales goal. 100% satisfaction or your brain back. So, what's the takeaway? If a doctor ever shows up with a barbecue skewer and says he can cure your anxiety, run, or play dead, back in the 1930s, if you said you were depressed, your options were electric shocks, getting locked up in an asylum, or a lobotomy. Basically, would you prefer your suffering electric, chemical, or handcrafted? Forget about any real testing. Diagnoses were done by eyeballing and a whole lot of guesswork. Psychiatry? It was a mix of barroom philosophy and Russian roulette. Freud was out there talking about the unconscious, but Moniz decided to skip the middleman and go straight to the hardware. It was like trying to fix a broken app by smashing the phone. The patient hears voices? Must be too many neural connections, let's cut a few. Seriously, that was the level of logic. In that context, lobotomy sounded like a genius move. If the patient went quiet afterward, boom, success. Silence equaled cure. Just like when you take the batteries out of the remote because it's stuck. The catch? The consequences went way beyond silence. Patients came back slow, apathetic, with empty stares. Many couldn't even tie their shoes anymore. But doctors called it a state of tranquility. Sure, who needs a personality when you can be a functional zombie? All of this happened because medicine was still crawling around in the dark. Literally, they were poking at the brain without really knowing what each part did. A brain map back then was vaguer than IKEA furniture instructions. Sol Rex's advice? When someone says they have a simple solution to a complex problem, be suspicious. If it really were simple, it'd already be solved, or wrecked, like it was back then. Imagine a doctor who decided to mix neurosurgery with a traveling talent show. Meet Walter Freeman. The man took lobotomy, tossed out the scalpel, and said, "You know what goes great with the human brain? An ice pick." Yep, an ice pick. The transorbital lobotomy was done using this everyday kitchen tool. It went in through the eyelid, broke through the thin bone behind the eye socket, and with a few back and forth motions, it severed brain connections. A top-tier brain souffle. Freeman wasn't even a surgeon, but that didn't stop him from operating on thousands of people across the United States. He traveled around in a van nicknamed the Lobotomobile, performing the procedure in schools, clinics, and, if allowed, probably the local grocery store. It was basically a neurological destruction food truck. And the criteria for surgery? Super flexible. Anxiety, lobotomy, PMS, lobotomy, insomnia, you guessed it, lobotomy. People were turning into test subjects at an industrial pace. Can you imagine if this existed today? Feeling stressed? Here, take a nice little brain pick. You'll sleep like a rock. No dreams, no thoughts, no opinions. And the weirdest part, Freeman proudly documented everything. He took before and after photos. The after always showed someone looking like they'd forgotten their own name, but to him, that was success. The patient stopped complaining. Mission accomplished. Sol Rex tip. If a so-called specialist seems more excited about their tool than about helping the patient, run. Or you might just end up as a human decorative piece. The history of lobotomy was already horrific, but then came the rotten cherry on top, the case of Rosemary Kennedy. Yes, from that Kennedy family. The sister of a future US president. She was a young woman with mild cognitive difficulties and mood swings. Nothing out of the ordinary by human standards. But her father, Joseph Kennedy, thought she was becoming too much of a problem. So, like any loving 1940s parent, insert heavy sarcasm, he did what no one should ever do. He authorized a lobotomy, performed by Freeman, of course, the showman of tragedy. The result? Rosemary was left incapacitated for the rest of her life. She couldn't speak, barely moved, and the family hid her away for decades because, hey, nothing spices up a presidential campaign like a buried dark secret. It's like taking your car to the mechanic for a weird noise and getting it back without wheels or an engine. But hey, no more noise, right? The Kennedy case shocked the American public, but only after it came to light years later. The press, which had once hailed Freeman as a genius, began to sniff out the stench of disaster. The lobotomy myth began to crack. Too late for far too many. And to make things even more macabre, the surgery was performed while Rosemary was awake. That's right. She was conscious as the tool was inserted into her brain. Freeman said the procedure was over when the patient stopped talking. A scientific criterion based on sadistic convenience. My advice? If you're in a room and someone starts a sentence with, "It's for your own good," think twice. It might be a good time to run like you just saw a hungry velociraptor. Now hold on to this one. Imagine being 12 years old, having a reasonably normal childhood, and one day your stepmother decides you're troubled. You're not breaking things, not fighting with other kids, just a bit introspective. Typical kid stuff. But in her mind, that was reason enough for brain surgery. Howard Dully was taken by this loving stepmother and his passive father straight to Walter Freeman's office. The diagnosis? Conduct disorder. The solution? Ice pick to the face. Literally. He was lobotomized without even knowing what that meant. He woke up quieter, more confused, more dulled. And that's how he lived without understanding why. Decades later, Howard began searching for answers. He uncovered records, notes, and reports. He became an author, an activist, and one of the most powerful voices against the barbarity of lobotomy. It's like waking up years later and discovering that your weird childhood behavior was used to justify cracking open your skull with a wrench. Freeman, meanwhile, wrote in his little notebook that the operation was a success because, you see, Howard had stopped being a nuisance. Sure, he'd also stopped smiling, stopped developing normally, stopped living without guilt baked into his brain. Howard survived, but many others weren't so lucky. And the worst part? Freeman kept getting patients, with a waiting list. America was hypnotized by the idea of a quick fix for any behavioral issue. Advice from a T-Rex. If your kid's acting up, take them to the playground, not to the surgeon. Simple as that. I honestly don't understand what goes on in your brains to allow for that kind of cruelty. After years of chaos, mass mutilations, and a mountain of damaged brains, something finally started to change in the US. And no, it wasn't because of medical remorse or a sudden burst of common sense. It was because psychiatric medications came onto the scene. Antipsychotics, antidepressants, anti-anxiety meds. In other words, pills that did the job without cracking anyone's skull open. It was like someone saying, "Hey, turns out there's a way to treat the human mind that doesn't look like a zombie movie." And the medical community went, "Seriously?" and we've been wasting all these ice picks. As the scandals piled up, lawsuits surged, and the scientific community finally woke up, lobotomy started losing ground. American medical associations began banning its use outside of extremely controlled environments, which, let's be honest, almost nobody was using anyway. The Nuremberg trials after World War II also introduced a revolutionary concept: medical ethics. That wild idea that maybe it's not okay to test bizarre procedures on human beings just because you feel like it. The world began to look at lobotomy and ask, how did we let this go on for so long? And Freeman? He was banned from performing surgeries after a patient died on the table while he was trying to break his own speed record. The man was literally timing lobotomies, like it was a burger flipping contest. So here's the takeaway. Be suspicious of quick fixes, especially if they involve sharp objects and words like pioneer or revolutionary, spoken by someone with a gleam in their eye and zero surgical credentials. The real tragedy of lobotomy isn't in the physical scars, it's in the idea behind the surgery, because at its core, it wasn't just about treating mental illness, it was about silencing, erasing, making invisible everything deemed too difficult to deal with. Women who disobeyed, men who didn't fit in, young people who questioned, restless children, elderly folks who cried. Lobotomy was often used as an off switch to shut down discomfort, to shut down difference, to shut down anything that didn't fit the rigid frame of American normalcy at the time. It was as if society said, "We don't know how to handle your pain, so we'll turn you into a houseplant. You'll decorate the room, but you won't speak, won't think, won't resist." The distortion was so deep that for decades, this was considered treatment. People who posed no threat to society had their brains butchered for being shy, melancholic, too creative, too rebellious. Anything that didn't fit the square mold of good behavior became a psychiatric diagnosis, and shortly after, a hole behind the eye. This use of science as a tool of oppression was the true nightmare. And it's not just about the past. Even today, the history of lobotomy is a chilling reminder of how the pursuit of order, control, and normalcy can become a factory of justifiable horrors. So, here's my advice, coming from a Sol Rex who's seen empires fall. Never underestimate humanity's ability to turn a solution into a tragedy, especially when the problem involves emotion, subjectivity, and suffering. The brain isn't a system you reboot with a screwdriver, it's who you are. Today, lobotomy lies buried in the graveyard of medicine's worst mistakes, and it deserves to be there, because beyond being torturous, it was a cruel way of erasing, of destroying thousands of living people under the excuse of treatment. Science has advanced, medications have evolved, and medical ethics have gained strength. But even so, every step forward needs to be watched closely, because the line between healing and control can be thinner than the tip of an ice pick. If you thought this was heavy, just wait until the next video. Go ahead and subscribe to the channel and drop a comment below. What was the most jaw-dropping part for you? Thanks for watching.